All right, Warren. So first of all, I want to thank you for helping us here, taking a little bit of time to do this quick pre-treatment interview. Many doctors forget this most important part. I kind of mentioned this to you when we first met last time, is that if we take care of the person, then the treatment itself will be easy, right? And you and I spend quite some time talking and answering questions and raising issues and so forth. And today you're much more relaxed even though you're in pain. And then I overheard you earlier say, oh, but many people probably wouldn't want to be in here, but I'm happy to have a root canal. So this is where I'm going to pass it on to you. I think this is going to help doctors understand there's a person and not just a tooth there, but it's going to help patients realize root canal treatments aren't just, the horrible thing that many say, but it's not, especially when the doctor understands that there's a person and does it right. So please, it's all yours.
Yeah, I've had several root canals before, and I think one of the two is a repeat root canal.
That's right.
Sorry, I'm all numbed up, but so I have, and as much as I like acupuncture, I don't have any problem with having my teeth worked on. I don't shy away from going to any dentist's office, and I am interested in new techniques and techniques that will improve my dental health. And keep me from having to have a tooth removed.
Sure.
I think that's one of the most important things. I'm hoping and praying that, that one tooth will get to stay in there. So,
absolutely.
And I'm, interested in the whole process. And look forward to having the pain go away. I know that's going to happen.
Sure. And we talk about the chance of success, especially that Mr. President, you gave me the weapons to go in. So our chances are great, But we did also cover the what if and be ready for that. So
Right.
Our chances are extremely good, but I see you relax. And you were asking me earlier, do I have to stay awake throughout the whole thing? And my answer to you is no, absolutely not. I would actually take it as a compliment if you could fall asleep. That means, and we'll have a mouth rest for you to rest your teeth on. You can just ignore me and we'll wake you up when we're about to land, right? We'll take off here. We'll be in the air, Mr. President.
Fantastic.
And then you rest and
I would love to fall asleep. I enjoy taking naps. So that would be great.
Excellent. Now, so do you feel anxious now at this point no, you don't, right? And that's the thing is, if we can make it such that root canal treatments are seen by patients like they're seen by you, then what would you tell patients who are wondering if this is a procedure that's going to be that they should be scared about?
I think so far getting yourself numbed up is just a normal process for having any tooth worked on, whether it be a filling or a root canal, and I've had all of them. It doesn't bother me, but I do know people that don't like needles, and for me, if I couldn't be in this chair, I'd love to be on the table for acupuncture. So that's just the way I am. Needles don't bother me, but
Sure.
I have kids that needles do, and they don't even want to check their blood sugar or anything like that. So,
absolutely.
I'm just more happy to have my face all numbed up and not feel the pain in my jaw.
Right.
So I'm a happy patient to get to have my teeth.
Sure, I'll make you happier, right? After
Exactly.
we've cleaned these canals. Now, totally aside, you are in teaching. You teach accounting.
Yes.
So you understand this is also for teaching purposes and spread the knowledge of saving teeth. So I want to personally thank you for, number one, taking the time to do this, but also to allow us to actually share this on our Facebook platform and social media in general. Because the more people understand there's a person in the chair more than the teeth, the better the world will be in terms of having less pain. So thank you for allowing us to do that.
My pleasure.
And then last question is, in terms of saving the teeth, why are you opting to have these teeth saved? I mean, I never recommend it for extraction, but you at one point asked the question is, what if we extracted these teeth? And you heard what I said, it's an option, but it's not a recommendation.
Right.
What are your thoughts now? Obviously we're going to save them, but are you convinced this is the option that's the best for you?
Yeah, I mean, the percentages are not exactly 100%, but
That's right.
that's okay. I mean, that's what you going to a procedure like this, you have to realize that. And but I'm an optimist about it, and
That's
I
right.
would much rather have the tooth than to have it pulled and then have to have a implant later.
That's right.
So this is much more important to me, and I appreciated your time and the teaching that you explained to me before. I just wish I could have had the procedure done that day, because you had me at let's do this.
But we're one team now, so
That's
Mr.
right,
President,
that's right.
let's go kick some butts, okay?
All
And
right, I'm ready for
the
my
bacteria,
nap.
the bacteria are already scared hearing me coming. So, any last word you want to say?
The bacteria's.
That's right.
funny.
That's the
funny.
enemy hiding it deep inside,
Yes,
you know.
I'm tired of that bacteria. It's been in my mouth for a while, and it's just been bugging me for several months.
Uh-huh.
So I'm glad we're going to get this done.
Okay,
So.
excellent. Last word maybe for anyone out there listening to this?
I wouldn't worry about it. Most of the pain on a root canal is just getting yourself numbed up. And
Okay.
once you're numbed up, you're good to go. It's
And
really
you're
not a
numb
problem.
now.
I'm good.
All
ready.
right.
I'm ready.
Air Force One is about to take off, Mr.
Okay.
President. Let's do
I
it.
hear it has a bed.
Thank you very much, Warren.
Thank you.
Yep.